Hi, my name is Dr. Schwartz, and we are going to discuss how to choose a good chiropractor. The first thing that you must decide is what is important to you. Is it quality of service? This will depend on the doctor's knowledge and experience, which you're really not going to know until you meet the doctor. Is the doctor a good diagnostician as well as practitioner? Does the doctor have any specialties? Okay, neurology is what I specialize in. Orthopedics, internal medicine, radiology. There are a variety of specialties in the chiropractic profession. We're not all the same. Do you want someone who is very close to home or to work? Are you primarily interested in whether the doctor participates in your insurance or not? Just because you find a participant doesn't mean that it's any better. It may be cheaper, but as the old saying goes, you get what you pay for. People or doctors that participate in certain insurances very often are under limitations, and therefore there are things that they cannot do for you that you might need. Okay, so but they're not going to get paid for it. The first visit should consist of a comprehensive consultation and neurological orthopedic exam in order to determine what is wrong with you. I can't stress that enough. There are too many patients that will call us up and they'll say, I know what my problem is, the sacroiliac problem, and my doctor just pops it back in place and I just need you to do that. Okay, there are many causes of the same type of symptoms, and therefore each one of them needs to be diagnosed properly so that we could properly find the best procedure that you will respond to and will not hurt you. Like I said, I'm a chiropractic neurologist. I am a specialist who performs many things that chiropractors do, plus there are unique treatments that I provide that the average chiropractor does not do. And I also do some things that neurologists do, especially neurological testing. I've had an extensive amount of education and postdoctorate degrees. I'm board certified in chiropractic neurology, and in electrodiagnosis. These are things that you need to know when choosing a doctor. If after the examination imaging is necessary, then we may have to send the patient out for those tests to be performed. If further neurological testing is necessary, I can provide that in my office. All of these procedures give us the information necessary to properly diagnose your condition. And through the correct diagnosis, we can determine the best treatment for your condition, which will allow for the best results in the shortest period of time, which I think is what you're looking for. I am absolutely appalled when a patient comes to me after going to a chiropractor who met with the patient for just a few minutes and then asked the patient to lie down, and although I despise the words, snapped and cracked him or her, I can't tell what the chiropractor did. I can't call what the chiropractor did was an adjustment, but it was some type of a treatment. If you're ever in a doctor's office and the doctor doesn't examine you but provides a treatment, no matter who that doctor is, even if it's a prescription, you should not walk. You should run out of the office as quickly as possible. I just heard about someone who had moderately high blood pressure. She called her physician who prescribed blood pressure medication on the phone. Yes, on the phone, without seeing the patient. Did she have coffee just before her pressure was taken? Was she smoking? Was she suddenly under stress? These are many factors that can cause blood pressure to temporarily rise. Who took her blood pressure, and was the machine accurate? How many times was the blood pressure taken? The bottom line is this: you need to investigate any doctor to find out how good he or she is, the type of education, experience, how thorough the doctor is, and his or her specialties before making that initial call. One other thing about insurance: most are terrible with regard to chiropractic, physical therapy, rehab. HMOs are the worst because of the severe restrictions that they place on the amount of treatments allowed. Having HMO insurance is not much better than having no insurance at all, except you're paying for it. mainly because of the restrictions and the poor reimbursement. I would question any doctor who participates in that type of insurance. Well, I hope you found this informative. Again, our telephone number is 941-365-6400 should you decide to call us.